I might just pause here because I don't see any hands raising. If you can hear me, can you just raise your hand in the chat box or on the side?
Seems like everyone can hear.
Okay. Okay, great. Maybe I can't see that. Okay, good. I'm happy to hear that. Okay, before we get started with the presentations, I'll just give a brief background on the project. The Measuring Separation in Emergencies project is an interagency initiative funded by USAID's Office of Foreign Disaster Assistance, OFDA, and coordinated by Save the Children in partnership with Columbia University. It is guided by an interagency advisory panel with advisors from various child protection agencies. The overall aim of MSiE is to strengthen emergency response programs for unaccompanied and separated children through the development of practical field-tested methods to assess the scale and nature of separation in emergencies. As some of you may be aware, it was first piloted in 2014 in a conflict-related setting in the Democratic Republic of Congo. It was later decided to also test these tools in a natural disaster setting, which brings us to our presentations today. The project team recently completed 2 pilots. The first pilot took place in the Tigray region of Ethiopia in 2016, where over 6 months the research team implemented a community-based surveillance system as part of the response to the drought and famine affecting the region. The second pilot took place earlier this year in the Sud region of Haiti, where the team implemented a population-based estimation survey following the devastation of Hurricane Matthew in October of last year. This webinar will discuss the results and learnings from these pilots, including recommendations for next steps in the development of the tools and the methods. I'm very happy to be on this webinar today with our presenters, Matt McFarlane and Beth Rubenstein. Our first presenter is Matt McFarlane, who will present the community-based surveillance pilot that was carried out in Ethiopia. Matt is a senior research associate with the CPC Learning Network. He has a Bachelor's of Science in Zoology from the University of Guelph in Ontario, Canada, and has a Master's of Public Health from Columbia. Previously, Matt worked with Innovations for Poverty Action in Sierra Leone, Ghana, and Liberia, managing a variety of projects, including creating and testing a mobile application for contact tracing of Ebola patients. He has also worked in Indonesia, Sierra Leone, and Senegal on topics including legal identity, teenage pregnancy, and bringing mobile technology to anti-malarial programs in rural settings. He has a passion for mobile solutions to child protection and health research issues, particularly around data collection in low-resource areas. Following Matt's presentation, there will be about 5 minutes for clarifying questions, and then we will open up the floor more generally for questions at the end of both of the presentations. I will also try to respond to any questions you have during the webinar in the comments box. However, I'm a child protection practitioner, and if you have specific questions regarding the methodology, I'll probably save those until the end for Matt or Beth to answer, just so you know if I don't respond to everything. Following Matt's presentation, Beth Rubenstein will present the findings from the population-based estimation that was conducted in Haiti earlier this year. Beth is also a senior research associate with the CPC network. She holds a Master's of Public Health and a Master's of Business Administration from Johns Hopkins University and is currently a PhD candidate at Columbia. She has over 10 years of applied experience in global health and human rights, including prevention of international child trafficking, health systems equity in Ghana and Rwanda, and HIV treatment access activism in South Africa. Beth also previously served as a Peace Corps volunteer in Madagascar, focusing on health and nutrition at the community level. So once again, following Beth's presentations, we'll have 5 minutes for clarifying questions regarding the presentation. And then I will give a brief overview of why this research is important to child protection practitioners before opening up to the wider question and answer period. So thank you again for joining us. I see some more people have joined, so that's great. So let's get started with our first presenter. Matt, over to you.
Great, thanks so much, Selena. I'll just begin by just repeating that. Welcome to everybody, and thank you for joining us today, and particularly apologies to those who tried to join last week and were unable to hear us. I'll just begin by thanking everyone who's involved with this project so far, particularly USAID and the Alliance, as well as the CPC Learning Network and our partners at Save the Children. As others have explained so far, the study focuses on a pilot to develop methods to measure unaccompanied and separated children in emergencies. I'll start with a brief summary of the broader initiative and the gap that it aims to fill, including both of the projects that you'll see presented today, and then move into the details on one of these, the community-based surveillance or community-based monitoring project in Ethiopia. So let's begin with something many of you may be familiar with, the definition of unaccompanied and separated children. For the purpose of this study, we defined unaccompanied and separated children using the definitions in the Interagency Guiding Principles on Unaccompanied and Separated Children. According to these definitions, separated children are those who have been separated from both parents or from their previous legal or customary primary caregiver, but not necessarily from other relatives. So separated children therefore might include children under the care of another adult family member or in other such customary care situations. Unaccompanied children, on the other hand, are children who have been separated from both parents and other relatives and are not being cared for by any adult who, by law or custom, is responsible for doing so. In other words, unaccompanied children are those without any responsible adult caregiver. The reason we're interested in this group, certainly there are many, but in general, separated children in emergencies particularly face a multitude of risks, including threats to their health and well-being. Compared to children who are not separated, these children may suffer from higher levels of food insecurity, higher levels of malnutrition and infection. They're also more likely to be exploited for labor and sex than their unseparated peers. And in the longer term, separation and lack of social support can have mental health impacts, including chronic stress, anxiety, or depression. So the humanitarian community does offer minimum standards to guide organizations in establishing family tracing and reunification programming, but there currently aren't any guidelines for quantifying the overall magnitude of separation in an emergency setting. Because of this, practitioners and policymakers end up approximating the scope of a separation based on generalizations and selective data. For example, one estimation strategy uses a rule of thumb, which suggests that unaccompanied and separated children typically make up approximately 3 to 5% of the displaced population during emergencies. This approach has never been validated, and furthermore uses a one-size-fits-all rule, which is inconsistent with the diverse circumstances of different emergencies, comparing a conflict setting to a natural disaster setting. Other data can be taken from things like case management or program records, but these are incomplete by design, focusing on the population specifically affected by that program. Further, they're often unique to their own organizational and programmatic needs, making them incompatible with other systems. Finally, there are tools like the Child Protection Rapid Assessment, which exist to provide a qualitative snapshot of the population, but rely on key informants as their main sources of information and may miss certain groups. So ultimately, the lack of rigorous data, the lack of a real representative number of children separated in emergency, really impedes efforts to fund, design, and implement effective programming and policies for affected populations. So in response to these issues, a few years ago, the Global Protection Cluster emphasized the need to have a tool that measures the actual figures of unaccompanied and separated children in emergencies. Following that call, a multi-sectorial advisory panel was created with representatives from a wide array of organizations that contribute to supporting unaccompanied and separated children in emergencies. Save the Children and Columbia University were designated to lead the initiative on behalf of the Alliance for Child Protection and Humanitarian Action, with Save the Children as the main overseer and Columbia University acting as lead methodologists. Over the course of the initiative, it has grown to encompass 4 separate tools that target different aspects of understanding the scale and characteristics of the unaccompanied and separated children population in emergencies. Today, you'll hear about the first 2 of these, population-based estimation and community surveillance. So I'll now be talking about the third component undertaken by the team, the surveillance tool to capture changes in the frequency and nature of separation over time. This is the first known effort to set up a community-based surveillance system to capture unaccompanied and separated children in an emergency setting. Just as a brief introduction, a community-based surveillance system can provide continuous and nuanced reports from hard-to-access locations to inform better provision of program services, to adapt to changing needs, and to determine when alternative measurement strategies are needed to evaluate current conditions. So what is community-based surveillance? Community-based surveillance refers to the ongoing and systematic collection of data at the community level, often using community members themselves as informants. In essence, it taps into the knowledge that is inherent in communities between neighbors, but is not apparent to outside actors without spending time and effort to investigate. Such systems have been used in resource-poor settings, including emergencies, to actively collect information and monitor trends on a broad range of topics, including nutrition, polio, maternal health, malaria, drug resistance, and mortality. Community-based surveillance systems encourage communities to engage in a given issue and can fill gaps in passive facility-based detection in places where health and social service centers do not adequately capture the information. Additionally, community members are often willing to report on their surroundings for free or minimal compensation, so the costs of gathering information are lower than with other systems. Community-based surveillance is increasingly operationalized by asking informants to use phones to report data to a central database, often via text message. This is known as mobile phone-based community surveillance. Compared to traditional paper-based community surveillance, the use of mobile phones has led to improved data flow, reduced time for data collection, fewer data entry errors, and reduced transmission costs. Mobile phone-based community surveillance is particularly well suited for emergencies, where the research team's ability to safely access certain areas can rapidly change. And in these settings, mobile phone-based systems is often the only way to get uninterrupted information. So with those factors in mind, we chose to use a mobile phone-based community surveillance approach in the broader initiative. So as mentioned, the goal of the surveillance program is to fit into the response period to an emergency. Following the one-time snapshot of a household survey that you'll hear about a little bit later on today, the surveillance approach is designed to provide longer-term trend information in comparison to that one-time snapshot. So going back, we first piloted the surveillance program in the Eastern Democratic Republic of Congo in 2014. If you're interested, you can find a webinar and further details about that research on the CPC Learning Network website. While the DRC pilot confirmed the basic feasibility of the method in a difficult environment, a conflict setting, we also identified multiple areas for improvement and further study. The most important one was the short time period. In the DRC, the project only lasted 11 weeks, which meant that it was more difficult to determine how seasonal changes would affect participation and would affect results. Particularly, it was of interest to see whether the message quality improved over time and whether the consistency in messaging changed as motivation lowered or increased. The program in the DRC was also tied very closely with a local NGO who would physically visit each case, as this would not always be viable or possible in emergency settings. That was another aspect to assess in a second pilot. Finally, there's an inherent difference in conflict settings such as the DRC compared to non-conflict settings and natural disasters. So we also wanted to evaluate any changes there. So the objective of the community-based surveillance system was to test the feasibility of setting up a system capable of continuous, ongoing measurement of trends and basic characteristics of unaccompanied and separated children in defined areas in Ethiopia. We aim to develop and implement a safe, cost-efficient, community-driven mechanism that provided real-time continuous data. Of key interest following the DRC pilot was also going in more in depth on comparing results, particularly message consistency and quality across groups of focal points, such as males versus females and elected versus traditional leadership. Given the eventual hope to make this available outside the existing project group, the team also wanted to observe the challenges of working remotely through existing organizations and with child protection mechanisms that were already in place. So now I'm going to go just into a bit more detail about the methods and results, including the case definitions, study sites, focal point selection, and reporting protocol. So in late 2015, it became clear that the El Nino influenced drought in multiple areas of Eastern Africa would lead to a severe famine, likely beginning in March or April of 2016. The research team at this time determined that the Ethiopian context would be an appropriate area to have a second pilot of the community surveillance project. In consultation with local partners, including the government of Ethiopia and the National Child Protection Subcluster, it was determined that the appropriate area for the study would be the Tigray region in northern Ethiopia, Shire County specifically, and within that, the rural ward of Adwa was selected due to its status as a priority 2 area for drought response. This decision was made as it was deemed close to the affected areas and thus likely to see movement of children through it, while also not giving any potential to interfere with response programs in the highest priority areas. As you can see here, this is just a map of Ethiopia. The very northern point, region of Tigray, and that red circle indicates where within that region we worked. So East Tigray was a priority 1 area, and we worked just to the side of that. So the research team were hosted by IOM in the Shire region, the International Organization on Migration, and spent some time building up relationships with the Ethiopian Ministry of Women and Children's Affairs, or MAUCA, at both the national and particularly at the regional level, and the district level as well. A local coordinator was hired from within the IOM system who grew up in the area and spoke Tigrinya, and he took responsibility for the project and relationships in the region over the course of this 6-month period. The first step was to select kabeles, which is essentially counties within the chosen warda, which is a region of approximately 2,000 households, each kabele. Within each of those kabeles where the system was piloted, the research team visited and presented the leadership of that kabele. The leader presented him or her with an overview of the proposed project and requested their support. Once this was given, that leader then helped to select villages within their area of authority. If the kabele chief did consent to participate in the project, and all of them did, he then facilitated a community meeting in the village chosen so that the research team could present and explain the project to the wider public. After the program had been presented and all questions had been answered, the community was asked to provide verbal consent to participate. Happily, all 10 communities visited by the research team agreed to participate. So within each village, 3 focal points were chosen. This is one area where there was a bit of a difference between the DRC and Ethiopia. As in the DRC, there was a traditional chief who was automatically chosen to be one of the focal points. Within Ethiopia, they did not have such a structure. It was a more democratic approach, and they had things called development groups, both male development groups and females. So one focal point was chosen from each of those two groups, and then a third was a member of the community who was not part of the traditional leadership, and they were elected. At least one of the three members had to be a female, and in some cases there were two females for a village. The reason for selection of three different focal points was to determine whether differences in reporting patterns could be observed based on the role of the focal point in the community or the mechanism of selection. Once identified, the focal points were responsible for reporting within a defined geographic area of approximately 100 to 150 houses in their community. All three focal points in a village were responsible for reporting in the same area. In the village, after the selection process, the researchers walked around borders of the reporting area, or in some cases with very large areas, worked with them to identify the borders. With the focal points, they stressed that they should only report on cases occurring within these boundaries, and that they should only report on new cases of separation, so no reports about any events that happened in the time leading up. This photo shows the focal point selection process in one of these villages, in which everybody essentially just raised their hand to vote for different individuals. All focal points that were selected participated in a 1-week training where they were introduced to the study methods and given a cell phone, as well as phone credit, an instruction manual, and a code book for reporting. Focal points were asked to learn about new cases through a variety of approaches, but the final decision and the final approach that they used was up to them. The most commonly reported were active visits to community members' households, while others relied on a more passive system of reports from other community members, or simply overhearing local conversations and observing children. So the broader system of the community surveillance approach, each focal point would have a mobile phone, and they received a small weekly allowance of phone credit, as well as reimbursement for each text message sent to the project phone, and money to pay for charging of the phones where necessary. The focal point was responsible for sending a text message whenever they heard about a case of separation. Once they sent their message to the central smartphone, which was under the custody of the local project coordinator, the messages that were received on that project phone would be used in two ways. First, the phone was connected to Frontline SMS, a free open source software that connects phones to its website and has a sort of inbox for text messages and phone calls that is automatically updated when the program phone was connected to it. The Columbia and Save the Children team was able to access that data and monitor the system remotely via the Frontline SMS website. Second, the project coordinator at IOM also followed up each reported case with a phone call to the focal point who sent the message. The project coordinator would ask the focal point questions to verify that the case was valid, meaning it was a new case of separation and that it occurred within the predefined boundaries. If the codes were entered incorrectly, the focal point was asked to resend with the correct code. Similar case reports in the same community were investigated and duplicates were removed once they were verified as such. In cases of urgent action being required, the project worked with community leadership and the Ministry of Women's and Children's Affairs in the area to utilize existing child protection mechanisms within those communities. Compared to the work in the DRC, there were a number of differences with the project in Ethiopia. One major point was that the communities in Ethiopia were often quite dispersed with unclear boundaries compared to the more compact villages that were found in the DRC. Without a community-based leadership, as I mentioned, all three focal points were elected, although some from within existing traditional leadership groups. Communities, but often in Ethiopia, were explicitly offered the option of using existing religious or social activities such as church or sembet, which would happen weekly, as a point of a source of information. This was particularly useful in those more dispersed communities where people would often not run into each other as often. And then the last difference was that the referral for those urgent action cases, as I mentioned, was within existing child protection systems in the area. This is just an image of one sort of village area where it was quite dispersed, and essentially working with the focal points, we drew and selected the boundaries for the area based on more conversation. So as I've already mentioned, when a focal point learned about a new case of separation, in the reporting zone, he or she would text a series of numeric codes to the central program phone. In order to give you a better sense of exactly how that process worked, you can see here the code book. Each text was a 6-component code that would capture a child's age, sex, whether they were separated or unaccompanied, as per our definition, whether they were departed or arriving, or whether they had remained in the same community, the reason for their separation if known, as well as the current caregiver. It was explicitly told to the focal points that it was not required to have all of this information. There is a don't know option for each one. They were not asked to speak with children directly, and so this is just essentially assessing the information they were able to gather at a community level. If the focal point had not found a case in the last week, each Sunday they were asked to send a single message composed of 4 zeros to confirm that they were still participating in the project. And in cases requiring urgent follow-up, such as a child in need of issue or child in need or a problem with the phone, the focal point was asked to send a code of 9999 to the coordinator, who would follow up as soon as possible. So the project coordinator would visit all villages several weeks into the project to learn about the experiences of the focal points, discuss cases, and examine any discrepancies. This happened on a bi-weekly basis for the first few months, and after that it happened on a monthly basis. During these supervision visits, the project coordinator would meet with each focal point individually and really discuss any issues that they were having as the project was going on. At the close of the project, all focal points were invited to a final meeting where individual exit interviews were performed to assess their experience and their viewpoints on the project. So moving into the results, over the 6-month period, 48 unique cases of separation were reported. Nearly half of those were reported in July, which was the first month of study, with reports tapering off until a small spike in December. As departures were concentrated at the beginning of this period, while the others were consistent throughout, there may be some patterns in terms of movement. There's multiple explanations for this kind of trend. It's possible that July was when the focal points were most engaged with the project and most likely to report. Or it could also be that this was when the impact of the drought was being felt most acutely, as it would begin to taper off following July. Another possibility is that children, especially older children who were out of school during the summer period, would be moving and traveling to city areas to look for work, to make money for school fees for the upcoming year. So the reported cases of arrived unaccompanied and separated children consisted of twice as many males compared to females, with an especially high number of boys moving in July. Children 10 and older were also much more likely to be separated, suggesting that a good percentage of the separation may have been, at least in part, intentional. In analyzing the circumstances surrounding the separations, death or disappearance of family members or parents was the most common reason, particularly in the month of July, which again may go back to this being the time that the drought was being felt most acutely. A significant number of children were also separated to look for work, particularly in the first few months. Information from the field, as I mentioned, indicates that it was common for adolescents in particular to travel and look for work when school was not in session, which may explain some of this movement. While the most likely current caregiver was a grandparent, one of the most striking findings was the high number of unaccompanied children. Almost half of the reported cases were unaccompanied. Specifically, 40% of the children were living with other children or were living alone, and a further 10% were living with a non-family adult who may or may not have been a legal guardian. In terms of the actual focal point performance, all 29 focal points were analyzed to determine whether there were certain characteristics which predicted stronger performance. They were rated both on the ratio of correct to incorrect case reports and consistency, so how often they sent any message, whether that was a case report, a 0000, or an urgent action report of 9999. In terms of the actual findings, members of existing leadership groups and male focal points were slightly more likely to send correct case reports, but this was not a significant difference. In terms of consistency, more than 50% of focal points sent a message in at least 3/4 of the weeks within the 6-month study period. Elected focal points and those between ages 30 and 40 were slightly more likely to be consistent in sending messages. So in summary, we demonstrated that the mobile phone-based reporting system is feasible in the Ethiopian setting and will have some level of success over a longer time period than the original study. The intervention was relatively low cost, particularly, and it would be even more so for an organization with existing presence in the selected area. In the past version, the 11-week surveillance system cost approximately 1/3 as much as the snapshot household survey in the same area at a single point in time. And once established, the operating costs would be limited to site visit costs, small amounts for reimbursement of text messages, and the salary of the single project coordinator. Another strength of the system was its direct linkage to the existing response mechanisms. One point of focus, as I mentioned, for this round of study was to work within the child protection systems that already exist in the chosen communities, in this case, Kabyle Leadership and the Ministry of Women's and Children's Affairs. In doing so, costs were reduced, and the relationship with both the government and community leadership was heightened as they felt that the project respected their authority and jurisdiction over these important areas. Of course, the project also faced several limitations, including a few practical challenges. The phones were purchased locally through Ethiopia Telecom, and a few of them had issues over the 6-month length of the project. While phone network in the area was generally strong, one village did actually lose their cell phone tower at a point during the study period and had to go outside of the community to use their phones. Finally, the Frontline SMS program was actually blocked on Ethiopian internet during the study, approximately in October, which required the coordinator to then fill out any case reports and communication manually. Finally, inconsistent levels of reporting throughout the project period and uneven participation from focal points was an issue, with some focal points participating much more actively than others. There were often reasons for this, which was even clearer in the 6-month study. Focal points were explicitly told at the outset that as volunteers, they would not be expected to alter their regular lives for the sake of this project. This meant that some would travel away from their communities for a period or focus on their farm during harvest season, particularly in communities that were more spread out. This would often mean that they would not interact with their neighbors as often as they would have in other seasons. One positive note that did come out of this project was that the focal points felt very comfortable with the coordinator and often informed him if they were going to be away. But this issue does indicate challenges in a longer-term surveillance project. So overall, the second long-term pilot built on the results and information from the first round in a uniquely challenging setting. As in the DRC, the project was successful, but it does take maintenance over time, including a program coordinator, cell phone charging, people losing phones, etc. There are certainly challenges to community surveillance more broadly. In particular, community needs and expectations are difficult to sometimes manage, as if you're working through existing systems, there isn't necessarily case follow-up in every situation that they might hope there to be. As mentioned, the volunteer nature of the work is always a challenge, particularly with focal points being motivated to participate, but it will always come secondarily to life priorities such as travel or farming. And then there's a few other practical challenges I mentioned, including network and technical and equipment issues. Another issue is that the data cannot be generalized or used for enumeration. This is exclusively for monitoring trends in a small pre-selected area. And the data quality will be highly dependent on focal points. That data quality sometimes may have a high level of consistency with some focal points or a lower level of consistency or accuracy with others. So the balance between the surveillance method is a way of monitoring trends in numbers, not necessarily identifying cases, but it could be used in this way. The focal points would have to deal with a lot of community expectations, as I mentioned, and the information being provided to them on separation compared to what is actually going to be done in the communities with each individual case. So that's everything for me. Please, if you have any questions, go ahead and raise your hand, and we'll get to you right away. Thank you.
Great, thank you very much, Matt, for that excellent presentation. So if anyone has any clarifying questions, if there's anything unclear on Matt's presentation, just go ahead and we'll give a few minutes. Otherwise, you can continue to ask any questions during the next presentation as well. And as I mentioned, we will be opening up for a more general question and answer period after Beth's presentation. So we'll go ahead with our next presenter, Beth Rubenstein, who will be...
it actually looks like
Sorry?
Lindsay Rogers has raised her hand, so I'll unmute her.
Okay, great.
Go ahead, Lindsay. Okay, maybe not.
No, okay.
Sorry, it might have just been a mistake. So just go ahead, Selena.
Okay. So we'll go ahead with our next presentation from Beth Rubenstein on the population-based estimation that we facilitated in Haiti between January to March of this year. So Beth, over to you.
Thanks, Selena. Just give me 1 second to pull up the PowerPoint. Great. Thanks for the behind-the-scenes tech support, Matt. So the second method that we piloted was population-based estimation. And the purpose of this method is to estimate the point prevalence and basic characteristics of unaccompanied and separated children in a defined area. In other words, this method is intended to tell us how many unaccompanied and separated children are in a given place and what their characteristics are. The foundation of the population-based method is a household survey, which means that information is collected by systematically interviewing a sample of households. Because of this approach, unlike the surveillance method, the population-based estimation is designed to generate numbers that are statistically representative of the area where it is implemented. We first piloted the population-based estimation in the Eastern Democratic Republic of the Congo in 2014, and like the community surveillance, you can find a webinar and further details about the DRC research on the CPC website. While the DRC pilot did confirm the basic feasibility of the population-based estimation method in a difficult environment, we also identified a few areas for improvement. So first, in the DRC, we actually weren't able to collect data from a representative sample of villages. This was because many of the villages in the area weren't secure and we couldn't visit them. So as a result, our final DRC estimate didn't describe the overall level of separation in North Kivu. It only described the level of separation in the relatively secure areas of the province. For example, in the DRC, we found many more separated children were arriving into our sample compared with departing. However, this finding is really just very likely an artifact of the relative security of the places where we collected data. So in other words, the places where we collected data were perceived as relatively safe for the region. In addition, the recall period, which means the time frame in which we are asking about separation, was difficult to define in the DRC because of the protracted nature of the conflict there. For measurement purposes, we did want to ask about separation during a specific period of time. So we chose the most recent major conflict event, which was the M23 takeover of Goma. The respondents that we talked to did widely recognize this M23 takeover, but it had happened a full 18 months prior to our survey, which was a long time. We expect that this long recall period affected the quality of our data because we were asking people to reconstruct their households going quite some time back. So the setting that we selected for our second pilot was Haiti in the aftermath of Hurricane Matthew, and that pilot is the focus of my presentation today. Hurricane Matthew hit Haiti on October 4th, 2016. It was the worst hurricane to affect Haiti in a decade, and it caused serious damage to property, livestock, and infrastructure. Approximately 90% of homes on the southern peninsula of the island were affected. In addition, high levels of child separation were reported. In February 2017, which was approximately 4 months after the hurricane, we piloted the population-based estimation method in the Sud department, which was one of the 2 hurricane-affected departments in Haiti. And that's the one that the arrow is pointing to here. The primary outcome of interest in our study was the prevalence of unaccompanied and separated children in the Sud department in the 4-month period since Hurricane Matthew. The secondary outcome of interest was a profile of the characteristics of these children, including their age, sex, reasons for separation, and current caregiver. So now I'm going to talk about the specific methods that we use to determine these outcomes. As previously mentioned, one thing that we realized following the DRC pilot was the need to refine our operational definition of separation and to develop a more structured approach to data collection. So using the UNICEF mixed household roster as a basis, we developed a new roster tool that would accurately answer the question, did a child's care status change following the emergency? So compared with our approach in DRC, which was focused on children's change in residence rather than their change in care status, this new question, did a child's care status change following the emergency, more accurately reflects the construct of separation that we're interested in. And asking about care status also solved the issue that we had in DRC regarding children who were miscategorized. Because unaccompanied and separated children could be living outside of a household, for example, some unaccompanied and separated children might live in residential care facilities, on the street, or with an armed group, a traditional household survey is always going to miss a segment of the population of interest. One way we tried to address this concern was by capturing information on 2 distinct populations of children. First, the survey measured arrivals, defined as separated or unaccompanied children who started living in the sampled household at any point following Hurricane Matthew, or who remained in the same household but lost a caregiver. And then second, the survey measured departures, defined as children who left the sampled household since Hurricane Matthew and were separated from their usual caregiver. Departures could include children who were living outside of households. Births and deaths weren't counted as arrivals or departures. So while you may be tempted to add the number of arrivals and departures to come up with a total number of separated and unaccompanied children in the sampled area, we don't recommend doing this for two reasons. One, respondents don't always know where a departed child is living. It could be that the child is living in another household within the sampled universe, in which case he or she would already have been counted in the arrivals. And two, it's possible that the departed child has left the sampling universe altogether. Therefore, we analyze these populations separately, also recognizing that separated children arriving in homes may have different characteristics and require different programmatic responses than the children who were departing from homes. This is our questionnaire. Like I said, it was modeled off of the household roster that was used in, or that is used in the UNICEF mixed survey, but we adapted their template for our specific research question. For those of you who can see the questions here, you'll notice that we asked respondents about household composition in general, before and after the hurricane, rather than separated children in particular. The rationale behind this indirect questioning approach was to reduce bias in case the respondents had an interest in either over or underestimating the true number of unaccompanied and separated children in their homes. For each child in the household, the data collector asked questions about the child's current caregiver and their past caregiver prior to the hurricane. So if the caregivers were the same before and after the hurricane, or if the caregiver was a biological parent, then the questionnaire just ended there. However, if the caregiver had changed since the hurricane, this would trigger an extra set of questions about the reasons for the change, where the child went, etc. The actual survey was done on tablets at the request of our local partners. The electronic data collection was very popular with the data collectors as well as the researchers, since this approach saved lots of time and reduced data entry error. In addition to the electronic questionnaire, enumerators used laminated cards to physically represent each member of the household to the respondent and serve as prompts throughout the survey. These cards were a carryover from the DRC pilot, which we did not do electronically. But the cards worked very well, and they allowed the respondent to engage and visualize their household. So we sort of combined the electronic and physical methods from the DRC. We selected our sample using a two-stage cluster design using probability proportionate to size sampling to select our clusters in a way that was representative of the entire SUD department. I'm not going to go into detail about how the sampling was done during this presentation, but we will describe the methods in detail in our written report, and I'm happy to discuss this with anyone who's interested offline. Essentially, the methods that we used followed well-established research standards for selecting a representative sample. In order to get a sample that was large enough to precisely detect a relatively small prevalence of separation, we visited 35 clusters or villages and interviewed approximately 25 households in each cluster. This yielded a total sample of 1,044 households. The primary respondents who we interviewed were either heads of household or other adults. When she was available, our preference was to interview the female head of household. However, we also systematically interviewed some alternative respondents so that we could compare the reliability of their answers to the female heads of household. In addition, if there was no adult residing in the sampled household, for example, because it was a child-headed household, we also made an exception to our adult criteria and interviewed the oldest person in the household, even if that person was under 18. We developed a modified version of the questionnaire for these interviews, these potential interviews with respondents who are under 18. So to summarize the changes that we made to the methods compared to the DRC pilot, first, the study was conducted in an acute onset emergency with a shorter recall period and a clearer definition of separation. Second, due to improvements in our definitions and our sampling, we were able to capture most child-headed households and exclude children who left the household after the emergency but didn't change caregivers. And third, we were also able to obtain a representative sample since the research team's movements in Haiti were not restricted by security concerns. I do want to point out that because of these methodological differences, it's not appropriate to make direct comparisons between the results from the DRC and the results from Haiti. The purpose of doing a second pilot was really to continue to refine the methods themselves rather than to generate comparable prevalence estimates across the DRC and Haiti. So even though the results aren't comparable, they do provide valuable insights into separation in Haiti in the aftermath of Hurricane Matthew. These are our main results. In the sample of all children who were living in the respondent's home at the time of data collection, almost 3% were children who, or a little over 3% were children who had newly arrived in the household since Hurricane Matthew, or who had remained in the same household since Matthew but lost a caregiver during this period. Slightly more than half of these 62 arriving children were male, and most were between 5 and 14 years of age. In the sample of all children who were living in the respondent's home prior to Hurricane Matthew, 1.1% had since departed from the household and were separated from their usual caregiver. About 40% of these 23 departing children were male, and their ages were approximately evenly distributed from 5 to 17 years. Aunts, uncles, and grandparents were the most common current caregivers for both the arrivals and the departures, which indicated that most children were in situations that are likely to be defined as customary care arrangements. However, given the way that we operationalize the definition of separation, which I explained earlier in the presentation, we did still count children in these situations as separated, which may be a limitation of our findings. School was the most commonly reported reason for separation, and this held true for both arrivals and departures. And consistent with the fact that school was the most prominent reason for separation, the vast majority of respondents indicated that the separations occurred as part of a deliberate decision-making process. Although the study generated many insights, of course, it did also have its limitations. First, the results are representative only for the Sud Department, which was not the only area in Haiti that was affected by the hurricane. Grand Danse was also heavily impacted and is not captured by the study. So while we can call the results representative for Sud, we can't call the results representative for all of Haiti or even for the hurricane-affected region. Second, although the 4-month recall period was a significant improvement from the protracted 18-month recall period that we used in the DRC, it's important not to interpret the results from Haiti as an indicator of immediate outcomes from Hurricane Matthew. In fact, some of the cases of separation may not even be directly or indirectly related to the hurricane because there's always some kind of baseline level of separation happening in any context. Third, because we used a household sample, the method likely underrepresented certain categories of children who live outside of households, such as children in residential care facilities and street children. This problem is particularly true for the estimation of arrivals, since in theory, children who departed for living situations outside of households would still be captured. Due to this limitation, we did pilot a third method in Haiti that was specifically focused on estimating separation in residential care institutions, and we're going to hold an additional webinar about this pilot in the coming months. So the results that I presented represent our preliminary findings, and we do have plans to continue with our analysis over the next few weeks. The final results will be shared in a written report and eventually a peer-reviewed publication. The main additional analysis that we're working on is on the data we collected regarding alternative respondents other than the female heads of household. Specifically, we collected data from both neighbors and other household members, and we're interested in evaluating whether or not their answers were consistent with the data that was reported by the female heads. The findings from these sub-analyses will allow us to continue to refine the methods and potentially conduct another pilot in a different setting with different challenges. We'd also like to reflect a bit more on what our recommendations will be about when the population-based estimation should be carried out after an emergency. We'd originally envisioned that data collection should ideally happen 6 to 8 weeks after an acute onset emergency, but after our experience in Haiti, we think that there may be advantages to waiting a bit longer so that the study doesn't interfere with initial emergency relief efforts. Waiting a few months to collect data also helps to identify secondary separations and avoids miscapturing short-term temporary separations that quickly resolve themselves. Last but not least, we also had a phone call with our advisory panel 2 weeks ago, and one of the main points of discussion was the need to improve the ease of use of household survey methodology among the broader child protection community. The health sector routinely conducts household surveys in the field, and the advisory panel recommended we learn more about how they're able to build appropriate capacity for this type of research work. So that's it for me. I think we're going to open it up to questions from everybody now, but we can start, I guess, with clarifying questions and then get into more discussion.
Thank you very much, Beth, for these insights and considerations. So as Beth mentioned, if anyone has any clarifying questions, just raise your hand or type that in the chat box. And then I will just very briefly give a small presentation from a practitioner's point of view before we open up for wider questions and answers. We have about half an hour left, so more than enough time for a discussion on some of the information and points raised in the presentations today. So I'm very happy for the opportunity to share some thoughts on what this research means in the field for child protection practitioners. As someone who has worked in child protection, as well as in field settings for over 10 years now, it has been very interesting to be a part of this project. Working with unaccompanied and separated children is, of course, one of the main pillars of child protection work in emergencies. And as all of us on the call can relate to, in emergencies, it is often extremely difficult to determine accurate numbers of unaccompanied separated children, especially when working across different agencies or in a regional emergency context. One of the exciting things about these tools is that they will enable child protection practitioners to obtain more accurate numbers of unaccompanied separated children, as well as more information on the basic characteristics of the children who are separated or who may be at risk of separation. And in this sense, will be able to guide us in our work, particularly in securing funding from donors for child protection activities, since we will have more accurate information of unaccompanied separated children, as well as for hiring adequate number of child protection staff members, particularly in relation to case management and family tracing reunification activities, because once again, we'll have more accurate numbers of unaccompanied and separated children, which will be able to inform our programming. Also, we'll be able to target programming in locations where there are greater numbers of unaccompanied separated children, or tailor programming specifically for children who are separated. We might see that there is a certain population being affected, or a certain age group or sex. And finally, it will inform preparedness planning. In Haiti, for example, it is located on the hurricane belt. While Hurricane Matthew was the strongest hurricane in a decade, There are hurricanes each year, and they will most likely continue. So as a result of a tool like the population-based estimation, we're able to identify locations that are more vulnerable to separation, that are affected, and work with the government and community members to better prepare for future emergency situations. So I'll keep this brief. However, to conclude, it's true that every country context is different, as is every emergency situation. And there is a need for more piloting of these tools and for agencies to commit resources into facilitating them so that the evidence base can continue to be built across different contexts. So once again, I'd like to thank our presenters, Matt and Beth. And now we'll open up to wider questions and answers. I'm sure some of you have some questions, so please do type them into the chat box, and we're all here to answer. Great, and for those of you who do need to leave, I hope you all have a very nice weekend, and thanks again for joining us. But we'll stay online to answer any questions that you may have for participants that are remaining.
Yep, and for anyone that wants to prefer to speak, just feel free to raise your hand and we can unmute you and have you verbalize your question. So this is a question from Phoebe Marabi. She asks, on the population-based estimation, would it be possible to include institutions? And I'm assuming by that you mean the residential care institutions. As Beth mentioned, and she can chime in as well, if that was absolutely a consideration, and it is something that we have considered. As she mentioned, we did do a small, very preliminary pilot of an evaluation of children moving into and out of residential care institutions in that area of Haiti. That is not necessarily the same methods or processes that existed for the household survey, but it absolutely is something that we've looked at. And once we are able to evaluate those findings and discuss with our advisory panel, there should be a webinar in the future to discuss that process and those results.
And just to add, the reason that any study on separation in institutions does need to be done separately is because of the way that you construct your sampling frame, meaning kind of the net in which, or the kind of the overall map of how you select which households you're going to, or in the case of institutions, which institutions you're going to. That framework or map that you use for selecting the places where you're collecting data would be different if you were basing it on households versus institutions. So you're dealing with a different sampling frame. It's possible to do it, it just needs to be done sort of separately.
Absolutely. Okay, great. So Layla Karimli also has her hand up. So I'm just going to unmute you and feel free to go ahead with your question. Oh, yeah. Layla, you should be unmuted now. Okay, it seems like you prefer to type. No, okay, not a problem. But Adriana Davis has commented with a question asking, do you think the community surveillance focal points would have been more motivated and consistently active had they seen some type of service response for identified cases, not just for urgent cases, rather than just providing info to be used to analyze trends? That's a really excellent question. and that we did notice a little bit of that among the community expectations, as I discussed, and that's really, I think, one of the next steps for a program like community-based surveillance is at the beginning, certainly setting out an understanding with the community of what kind of case report, for example, would require an urgent action. So, for example, many of the cases were essentially this 12-year-old person has recently arrived in this village and they're staying with their grandmother. And in many cases, that would not be considered an urgent action, but it potentially could require some follow-up. So that's absolutely an area to explore with the surveillance program, one of those next steps. And it's something that we look forward to kind of discussing with the sector more broadly, how this tool fits into potentially an emergency response, whether it fits well into an existing organization's monitoring and evaluation program, or if it's an outside thing for just a short period. I think there's a lot of potential, and the question that you ask is absolutely something to consider moving forward.
And in the DRC, we did have more of a response mechanism, but we did purposefully want to see how the system worked without a response mechanism, because there are inevitably going to be places where it's not possible to set up a full response mechanism, and then kind of it begs the question, does that mean that you shouldn't even try to collect data in those places? So is it all or nothing? And maybe the answer is yes, but I think that it's open to debate. And the other thing is that there could be concerns that a response, knowing that there would be services available, might skew the data in other ways and motivate focal points to potentially misreport information in hopes of securing services for their friends and family, theoretically. I mean, again, we don't have answers to those questions, but they are considerations.
There's absolutely also the issue of safety of the focal points, which has to be paramount. And in certainly, especially conflict settings, there may be a real question of security for those people if they're seen as being linkages to existing programs, to, for example, a UNICEF or a Save the Children, if they're seen as being agents of that in the community. And for example, if there's a case follow-up for one situation, but not a case follow-up for a separate but similar situation, it could put those individuals at risk, which is, again, one of those, it's a very difficult question. But I think that's an excellent question. Does anybody else have anything to ask? Okay, great. So it looks like Phoebe again. If you'd like to go ahead and speak, that would be great.
Thank you. I see I'm unmuted now. I have around 2 questions, I think, on the community surveillance. You briefly touched on the security, especially on conflict settings, and I was just thinking, if you use the phone method, the mobile phone-based method, and it's a conflict setup, I'm just thinking about probably an example of a place like Nigeria, where they would, if someone comes in, they would really be interested, and you get this information, and maybe they tap into the phone systems. How would that be a challenge, or have we thought around that, and how would we go about that? And then another one was about, still on the community surveillance, I was just thinking again on the network challenges, again, based on the phone system, and also maybe in places like, it's good that you're able to get probably the government officials to respond to cases, or rather that you could refer cases in place in where you did it. But I was just imagining also the same context in places you wouldn't find people, service providers in each kebele, for example, and you might have to refer to the warrior, which you might not really know if they followed up or not. And as from an ethical child protection perspective, it's good if you see an urgent, get an urgent case, then it's referred for follow-up and services. But then with this, we can't really, if you're not doing programming, then you wouldn't really follow up to ensure that that is done. So how do we tighten that in terms of referral and ensuring that they get assistance? Yeah.
Thank you. Those are really both excellent questions and things that we've thought about, not just for this pilot, but for the broader initiative and the broader idea of surveillance. I think the first one is a really excellent point. It is relatively secure data, but you're entirely correct that it's possible that, especially in a conflict setting, some actor might be able to tap into that. Certainly if one of those members of a conflict setting is actually the government, who has control over something like the telecom system, that would be possible. In terms of looking at that for future iterations of this program, I think it would have to be something that it would essentially be a case-by-case basis on whether it's applicable or not. If it's decided in advance, if it's known that this is a risk, it may be that you have to use a slightly different approach, or it may not even be feasible in that area. And I think that's always going to be a concern, and it has to be evaluated for each individual situation.
I guess, and then so your second question would be how to respond to urgent action cases in contexts where there might be very limited programming available. And, I think it's really a question of how to balance. We did want to make sure that there was some minimum level of programming in place before we started a study like this. But I guess the question is what is an acceptable minimum standard for programming? And I think that's something that really does need to be discussed with local partners before you proceed. If you set the standard so high, you'll never be able to get data. But I think different people draw that line in a different place, and ultimately, it's something that just needs to be decided locally, and in conjunction with the communities as well.
Agreed. And just, I think on this same topic, Adriana has a comment. I'll just read it out here. She says, I used to work in DRC in child soldier and vulnerable children release, rehabilitation, and reintegration programs implemented by UNICEF and community protection and early warning systems in LRA affected areas. Security and access for case follow-up was an issue for response, but often this issue was that we only conceived of, quote, response as official response from the UN or government officials, not from existing NGOs or community actors who were previously trained in psychosocial or other services under other programs. So the question of whether we should even identify at all, if no capacity for response, needs to take into consideration all the possibilities for response, including community-based response, rather than doing nothing and leaving the child vulnerable and isolated. And I think that's actually a really great summary of the way that we envisioned this second round, where previously in the DRC there was that immediate follow-up from an existing organization, and this time in Ethiopia we worked more closely with those community level responses to ensure that there was follow-up, not only for the urgent action cases, but essentially follow-up that was locally seen as necessary and locally seen as appropriate. So somebody in the community, somebody at the Kebele or Warada level, which did all have systems in place to react to these things. They were better placed to be able to decide sometimes whether a specific case required a follow-up based on cultural factors and experience. So in the experience within Ethiopia, I'm throughout the process, the community leadership consistently knew about any cases that we mentioned to them in advance, particularly urgent action cases. I don't, maybe there were one or two that we informed them about that they didn't already know. So it really does show that strength of community level responses. And I think, as Beth mentioned, it's somewhere where that line is always going to be a hard thing. It's contextual, it's based on the organization implementing any program, and we'll really have to decide on a case-by-case basis where such a program is appropriate given the ability to respond. But thank you both for those excellent comments and questions. Is there anyone else who'd like to speak or type in a question? Great.
So if there's no more questions, then I think we'll end the call. We just have a few more minutes remaining anyways. Thank you again very much to Matt and Beth, and thank you to all of you who were able to join this webinar. And thank you to all of those who asked those excellent questions and who made inputs. They're very thoughtful insights and considerations. So I'd now like to wrap this webinar up. We've reached almost the end of our time together, but there is still much more learning to be had on this topic, and we look forward to continuing to work together. So I know that for those of you outside of North America, it's getting towards the end of the day now. So thank you all for joining us wherever you are in the world, and I hope you all have a wonderful weekend. Thank you.